So, to my fellow type 1s out there, today we're going to talk about a very serious topic when it comes to type 1, and that is depression and type 1. I had one of you mention that on one of the threads from my earlier videos, and yes, I'm going to do that topic today. So perhaps you're just finding me. If you are, welcome. This is almost my 80th Facebook Live. Perhaps you've been following me the whole time, or you're just following me now. My name is Dr. Jody Stanislaw. I've had type 1 for 40 years. I run a virtual practice helping patients like you get off the blood sugar roller coaster and feel empowered for how to get better blood sugar levels, a healthy A1C, and have a healthy life. So let's see, I guess I can't show you my decks. It's not here today. I think it's in the other room, and I don't want to leave you, so I'm not going to go get it. But I came on Facebook Live starting in the end of March because I just really wanted to provide inspiration to those of us with type 1 because this COVID world can be stressful. And I wanted to be a beam of light and positivity and inspiration for you. So I've been sharing some of my most valuable tips for the past 3 months on how we can live a healthy life. And I'm also, for those of you that have been following me know, I'm also a stickler on we deserve an A1C below 6.5. So there's a lot of lacks, I think, in the type 1 world, accepting 8s or 7s, high 6s. And the reality is we're doing damage to our body when we're that high. So a lot of people feel like it's impossible to get near a 6 or in the 5s, but that's because you haven't received the proper education and support that you need. And that's what I'm all about. My private patients, after working with me virtually, they see that it's possible. So I'm here to say it is possible. I also have a lot of great courses on my website that can help you. But today, it's a very important topic, and that's depression and diabetes. So some reports say we are 4 times more likely to deal with depression than the average person. Is that because our crazy blood sugar levels cause irritation to the brain and cause moodiness, and so then we get depressed? Or are we depressed first and then we stop taking care of ourselves and have crazy blood sugar levels and then fall into that vicious circle? I think it's probably a little combo of both. Just knowing you have diabetes and you have this big responsibility, that can be stressful. Or maybe you're like, I can do this, I've got this, but maybe your blood sugar levels are all over the place and you're feeling depressed because this kind of blood sugar level is not good for the brain, right? It's not good for the moods. Our moods follow our blood sugar levels. I have such a tightly controlled window of blood sugar levels now that even if I'm above 120 or 130, 140, I just don't feel as good as when I'm 80 or 90 or 100. We all tend to get used to feeling normal at whatever our normal is, right? So it's an important topic also to differentiate between I had a bad day or, I'm just feeling down because somebody just passed, right? Depression is like it's consistent. It holds on day to day. You're not interested in doing things you used to love anymore. You're just too tired to go to music or see your friends, right? Things that that you used to really like. And I definitely have dealt with depression on and off in my life. I think it probably runs in my family as well as both of the causes that I explained, right? That I deal with this thing, it gets overwhelming, I don't want to deal with it anymore, versus I'm feeling good, but my numbers are bad, and so my brain feels like it's not working as right. So I first want to just be talking about this to hopefully comfort any of you if you're feeling like you're dealing with depression, to remind you that you're not alone, right? It's interesting in our world. We always want to lead with our best foot and our best face, right? Our best foot forward. And sometimes it's scary or inappropriate to hide how we're really feeling. But then it can get kind of lonely and we are scared to talk about it. We're scared to share our true feelings. Maybe we think something's wrong with us and we're ashamed, right? Well, like I said, type 1s I've read, are theorized to have depression at 4 times a higher rate than the rest. So the first takeaway I want you to have from today's video is compassion for yourself, and you're not alone, okay? So depression is also just can be, part of being human. moodiness is part of being human, right? We're supposed to be able to feel the whole gamut of joy to sadness to excitement to fear. It's part of being human. And so I just want to, first of all, allow you to be okay with whatever mood you have right now. Just be okay with whatever mood you have right now, right? Just acceptance. The second thing is, before I do the second thing, I do want to share my personal story. I actually worked for Eli Lilly Pharmaceuticals before I went to med school because I wanted to just be an insulin rep and help patients better understand insulin. But that was a position you had to get promoted to. And so I actually started out selling Prozac, which was, the biggest selling antidepressant in the world, which I thought was so funny. And my funny quip is that I think that was probably one of the most depressing times of my life when I was selling Prozac. I'm quite sure I took Prozac at the time. And so I've dealt with a lot of depression in my life. I was really lonely then. I was really frustrated that I didn't continue my pre-med studies, which I eventually did, obviously. And I was in my my late 20s, and I just felt like I was becoming an adult, and I was scared. I didn't know what the whole adult world was about. I went through lots of therapy. I did go through an eating disorder rehab program also in my late 20s. I think eating disorders could be another topic because we with type 1 have a higher rate of eating disorders as well, as you can imagine, right? When we're like thinking about food and making every meal a math equation every day. And I just remember I started rebelling, and I just didn't want to have to calculate everything I ate anymore. So I was binging. And so when whoever is watching, when you ask me, have I dealt with depression? Yes, definitely. And, I know for those of you watching, if you've dealt with depression, I want you to know you're not alone. So what can we do, which was number 2, what can we do to help us move through this? Number 1 is to have compassion and to know you're not alone. And number 2 is, what are the steps we can take, right? Well, you got to find out what makes you happy, right? Exercise is one of the things that makes me extremely happy. And even if it doesn't make you happy, going outside and going on a walk has been proven to be a great mood lifter. You get fresh air, you move your body, right? Exercise in general, it releases serotonin, and we have a reduction in serotonin when we're feeling depressed. So for me, the reason why I love exercise so much is because it's my favorite antidepressant in the world. And then, of course, getting good sleep, right? Getting good sleep. We all know that when we don't get enough sleep, we are not happy people. So if you are dealing with depression, getting enough sleep is really important. But then there's the opposite side of that, right? If you sleep too much when you're depressed, that can be depressing. And so again, getting outside and going on a walk. And if those of you can't go outside right now, just moving your body, turning on music, listening to music can raise serotonin, moving your body and just dancing in your living room, right? So don't let I don't like to exercise or I can't exercise be an excuse, because you can always just move your body. I love turning on music and dancing for a song or two. So exercise, sleep, healthy food, right? Healthy food gives you the nutrients that you need, right? If you're eating processed foods or fast foods all the time, you're not getting the nutrients you need, not to mention what it's doing to your blood sugar levels. Good blood sugar levels and healthy food and knowing how to dose properly for your healthy food, those are all connected to feeling better. I have a great course that can help you with how to dose properly for your meals, because if you're only doing carb counting, it's not going to work, because dosing for meals is a lot more complicated than that, even though many of us haven't been taught that. So I have a course on my website. My website's drjodyn.com, and you can click on T1D classes, and my classes are there. So eating properly, sleeping, exercise, and then number 4, I work with patients and I always say, how are your 4 pillars of health? These are your 4 pillars. Are you exercising? Are you sleeping well? Are you eating healthy? And emotional health. So emotional health. Specific things that you can do for your emotional health are watch a funny movie, find a counselor if you need somebody to talk to, call a friend, right? Write a gratitude list. I just had a video yesterday on the power of making gratitude lists. I have a great course that I hope you'll check out. It's called How to Stay Positive and Avoid Burnout.